Did you know that something as simple as sunshine could help protect you from diabetes? Vitamin D, often called the sunshine vitamin, does more than just boost your mood and bone health. It plays a powerful role in how your body manages blood sugar. In this video, we'll break down the science, share the latest research, and show you how to optimize your vitamin D levels, naturally and effectively. Let's explore how vitamin D could be the missing piece in your diabetes prevention puzzle. Vitamin D, often referred to as the sunshine vitamin, plays a vital role in many aspects of health, including bone strength, immune function, and cardiovascular health. Recent research has also linked vitamin D to a reduced risk of developing type 2 diabetes. This fat-soluble vitamin may help regulate blood sugar levels and improve insulin sensitivity, making it a significant factor in diabetes prevention and management. Understanding diabetes and its risk factors. Type 2 diabetes is a chronic condition that affects the way the body processes blood glucose, sugar. It typically develops due to insulin resistance, where the body's cells no longer respond properly to insulin. Over time, the pancreas cannot produce enough insulin to compensate, leading to high blood sugar levels. Several factors increase the risk of developing type 2 diabetes, including obesity, physical inactivity, family history, poor diet, and certain ethnic backgrounds. Emerging research now points to vitamin D deficiency as another important yet often overlooked risk factor. Vitamin D's role in glucose metabolism. Vitamin D helps the body use insulin more effectively. Insulin is the hormone responsible for transporting glucose from the bloodstream into the cells, where it's used for energy. When vitamin D levels are adequate, it enhances the function of pancreatic beta cells, which are responsible for insulin production. Additionally, vitamin D increases the body's sensitivity to insulin by promoting the expression of insulin receptors in muscle and fat tissue. Moreover, vitamin D may reduce chronic inflammation, which is commonly associated with insulin resistance and metabolic syndrome. By lowering levels of inflammatory cytokines, vitamin D can help prevent the dysfunction of insulin-producing cells and support healthy blood sugar regulation. Vitamin D deficiency and increased diabetes. Risk. Multiple studies have found a strong association between low vitamin D levels and a higher risk of type 2 diabetes. People who are deficient in vitamin D are more likely to develop insulin resistance, metabolic syndrome, and elevated fasting blood glucose. This is particularly concerning in populations with limited sun exposure, darker skin pigmentation, or dietary habits low in vitamin D-rich foods. For instance, a large meta-analysis published in Diabetes Care found that individuals with the highest vitamin D levels had up to a 40% lower risk of developing type 2 diabetes compared to those with the lowest levels. Another study from the Journal of Clinical Endocrinology and Metabolism showed that vitamin D supplementation improved insulin sensitivity in individuals who were insulin resistant but not yet diabetic. Can supplementing vitamin D prevent diabetes? While observational studies strongly support a link between vitamin D and diabetes risk, interventional trials provide mixed results. Some studies suggest that supplementing with vitamin D, especially in individuals who are deficient, may improve insulin sensitivity and glucose metabolism. However, other studies report minimal or no benefit. The discrepancy may be due to differences in dosage, duration, baseline vitamin D levels, and participant characteristics. It's likely that vitamin D supplementation is most effective for people who are at risk of deficiency or already have low levels. How to optimize your vitamin D levels. Vitamin D is unique in that it can be obtained from sun exposure, food, and supplements. The best natural source is sunlight, which triggers the production of vitamin D in the skin. Just 10-30 minutes of midday sun exposure several times a week may be enough for most people, depending on skin tone and geographic location. Dietary sources include fatty fish, like salmon and mackerel, fortified dairy products, egg yolks, and mushrooms exposed to sunlight. However, it can be challenging to get enough vitamin D through diet alone, especially in winter months or for those with limited sun exposure. In such cases, supplementation might be necessary. The recommended daily intake for most adults ranges from 600 to 800 IU, but higher doses may be needed to correct a deficiency. It's important to consult a healthcare provider before starting supplements, as excessive intake can lead to toxicity. Vitamin D plays a multifaceted role in glucose metabolism, insulin sensitivity, and inflammation, three key factors in the development of type 2 diabetes. While more research is needed to determine the full extent of its impact, maintaining adequate vitamin D levels appears to be a promising and accessible way to lower diabetes risk. Through a combination of safe sun exposure, dietary choices, and supplements when necessary, individuals can support their overall metabolic health and potentially reduce their risk of developing type 2 diabetes.